a long struggle. But I know the people that are here for me, and they're behind me and backing me and helping me. Some of the best things that happened while I've been here has been meeting the people and the caring. And there's always a smile, always a pat on the back from nurses, technicians, and doctors. And when you're kind of in isolation and you can't see people, you've got people coming in and talking to you, and the human interaction was very important. My job is to get through the transplant process and get better, no matter what it takes. Their job is to help me. To me, they're heroes.
Mitchell was, you know, he was in a wheelchair and he couldn't walk and he couldn't feed himself, but he was bright-eyed and happy, and he was smart, and he was in school, and he had this lust for life. When Mitchell started to get sick in early 2010, I ended up having to call 911 a couple times. He was rushed to our local emergency room. And the first thing I would do when I would go to the emergency department was say, okay, I think something's hurting my child and that's what's causing all these problems. And they don't listen. So we brought him to UofM and they listened to me. And it was hard, and I was stressed, and I was confused. But the staff gave me the clarity and the focus that I needed. And I kind of just took a deep breath and I said, I want to let him go. When you have the support from and the respect from staff like I did, it empowered me to make that decision and to honor Mitchell's wishes. We all have the same goal. We all have that ultimate goal of healing the child. Why wouldn't we want to work together? UofM has really wrapped themselves around this concept.
From the time we came here, we felt comfortable. I think we rolled in, in the ambulance at about 5 to 12. And they were like, we've been waiting for you. I think just saying that we've been waiting for you, like, thank God. Like, okay, now we're finally gonna get a plan in place and we're gonna move forward and something's gonna happen. Somebody was never more than a phone call away. Question on anything, on meds, on this, on that. When she decided that we were going home under hospice care, and we knew it was the right decision, and her oncologist said, I'll come back and see you before you go. He said, what else can I do for you? And I thought, at this point, she's just told you that you got her through parts of this when she didn't think she could get through it herself. You're still asking more. I think just him and the entire staff, we just know an immense amount of gratitude for, because just all of those little things kind of made a difference.
She was born at an outside hospital. They didn't quite give her the care that we thought she needed. I knew if I could just get her here, it would be okay. And so I called, and she